Bill, in our last segment, you went through step by step your cure of a migraine headache, which I found to be very interesting and helpful, having had migraines, to go through that. In this session, I want to go through my experiences with a cure of phobias. Phobia is some event, some action, some sight or sound. It could be seeing a snake, it could be fear of flying, it could be fear of bridges, crossing a bridge, heights, anything that instantly creates terror and anxiety, as if it's a stimulus that suddenly causes that intense negative feeling.
You remember meeting our neighbor, Debbie.
Right.
Fear of flying.
Right.
Here she is in Kansas City and won't go anywhere that she can't drive.
Exactly. So this is a technique I learned through neuro-linguistic programming, which you've had experiences with more than I have. But the idea is that you take someone in their imagination up to the phobic experience, and then I'm going to introduce some modifications of it to mitigate the phobic experience.
Good.
In other words, cure the phobia.
Yeah.
So this was a patient I had who had the fear of flying, so much so that whenever she came to Mobile, where I was on sabbatical, she'd have to get on a bus from Minnesota all the way down to Mobile, and had done that for 2 or 3 years since her husband taught there at the university. She would not get on a plane, and that's, I'll come back to that later.
Right.
So we were at a social gathering, and I was telling her I was interested in phobia cures, and I'd heard she had this fear of flying. Did she want to go through the process? It wouldn't take very long. Yes. So what I did is I have her sit in a chair here. I'm holding her hand so she's here. I make her make a movie screen over here and project herself onto that screen until she can see herself on that screen doing whatever.
Do you like to have a person eyes open or shut, or is it their choice?
Their choice.
Their choice.
Generally better with eyes shut.
Just imagine that
So that they're into their head seeing the screen. And that's called dissociation. Now the reason I'm doing that is I want her to experience over here the visual sight, a movie motion picture of her experiencing the phobic experience, so that when I lead to the cure, she'll be able to see herself going through the phobic experience.
Good.
Now this dissociation technique is best understood by imagining yourself on a roller coaster. Shut your eyes, imagine you're on a roller coaster, and you will start to have the feelings of that drops and rise on a roller coaster. If I didn't dissociate you and have you see yourself on a roller coaster, you will not have those feelings, because you're here, your imagination's over there, and I've dissociated your feelings from that experience. And that's a critical part of the phobic cure, the way I did it.
Okay.
So I say to her, shut your eyes, don't do this association yet. Shut your eyes and begin to imagine yourself coming down a jetway of a plane. So she shuts her eyes and she goes like that. I mean, it shakes all over. It's very evident that she's having the phobic experience by watching her. She's going like that. So now I've got a signal of her internal state to watch.
Good.
Therefore, I can know when I've alleviated internal state by she doesn't shake when she has the imagined phobic experience.
Okay.
So I say to her, instead of this terrible anxiety, fear you have, how would you like to feel as you walk down a jetway and get on an airplane? Well, she said, I'd like to be calm. Okay, good. Now I want you to hold your fingers like this, your index fingers, and I want you to go back in your life, shut your eyes, go back into an experience where you're very calm. It may be on a beach, it may be in your bed at home, it may be taking a nap, it may be just sitting there quietly listening to wonderful music, but pick a specific experience in your past experience, and as you go into that calm state, see the thing around you, hear the sounds, smell the smells if there are any of that experience, and as you go into that calm state, nod your head and touch your 2 fingers together. So now I've got the person in a calm state. Now, come back to reality. Look at me, and this time I'd like another state you'd like to be in when you approach that airplane. Let's say you want to be exhilarated and confident. Let's say you want to be fully confident that you've achieved something very difficult to achieve. It could be in a sport, it could be in a dance, it could be in public speaking, whatever you want to go back to, a specific experience where you felt strongly confident. And put these two fingers together, and you don't need to tell me what it is. As you drift back into that confident experience, all the sights and sounds and smells and everything specific about that event, touch these two fingers together and nod that you into that confident experience. So now he's in the confidence. Now I've got calm, I got confidence, and in this particular patient, I built in 2 or 3 others, like exhilarated, excited, interested, whatever you want to pick, that she would pick as an alternate state to terror. I did those until I had 4 experiences. And then I had her say, okay, now, shut your eyes, and as you look at this movie screen, as you approach that airplane jetway, put all these 4 fingers together and hold it as you experience going into that airplane. Now open your hands. Then I would have her come back into reality, look at me, and say, now I want you to do the roller coaster experience, put all 4 fingers together again, and in your mind's eye, get on that airplane, approach the airplane, see yourself getting on the airplane, be in that airplane, and we don't get a jerk. So now she's able to do it in her mind without a jerk experience. And she looks kind of surprised. And then I have a future pace it. Imagine this a month from now.
When you say future, when you had the fingers together and you have somebody imaging differently than they did, what do you call what's the purpose of having the fingers together?
This in the mind, brain of that person is calm. This is confident. This is what the other states are.
But this is a body sensation.
Yeah. So that when I've collapsed,
so I'm using a body sensation to anchor a mental thought.
Yes. The thought brought these body sensations. Now, instead of that body sensation, I'm mixing these other 4 very strong.
And these are good ones, whereas the other body sensation
is negative.
Was negative and fearful.
Right. So now I've collapsed that anchor, and in their brain, these things are firing off, I suppose, all simultaneously.
So I've anchored with my body a mental thought.
Right.
And the one mental thought was fearful, and the other mental thoughts were positive.
With feelings that are
with
strong emotional state and feelings.
Of good.
Right.
Positive instead of negative.
Right.
Okay.
And so now I future pace by having imagine in her mind's eye she's getting on a plane a month from now. I usually move it out 6 months, in a year. In her mind, she can get on that plane with no jerk. So it takes about, what's taking here, 10 minutes to do this thing.
Yeah.
So I see her about 3 months later, and I said, how you doing? She said, well, I just flew in from Minnesota. Oh, really? Yeah. I said, it looks like that little station the other night alleviated your phobia. Oh, it had nothing to do with it whatsoever. And what's remarkable to me is when you do this with people, they will not admit that the phobia cure or the collapsing of these ankles had anything to do with, they just made up their mind to do it and did it.
Even if it's not an admission, it's so subtle, the communication between body and mind and body is so subtle, so out of conscious awareness, that the person denies the mechanism, denies the means to success.
Right.
Or doesn't even remember it. Right. It may be amnestic.
Exactly. And that's been my experience in phobia cures. I haven't done that many, but of the ones I've done, none would say, yeah, that worked. They would just say, well, I stopped having that.
Yeah.
Anyway.
And doesn't know how come it happened.
That's right. So
well, in a sense, it is unexplainable by any scientific method.
Exactly. But I pass that on to our viewers. They can do that themselves. You have a technique where you put the negative feeling state in the left hand, if they're right-handed, and you build all those ankles I just built into the right hand.
The right hand.
And fire them, and simultaneously release both fist
And that's called collapsing the anchors.
Right.
So when a person does that, they can immediately
Right.
notice the switch from negatives to positive.
Exactly. And in my technique, which is NLP also,
You're individual.
this is collapsing the anchor.
Yeah.
And I do it this way because if they have a little return of the phobia, they could always just touch their fingers together and get a resurge of these mixed feelings.
Okay. What I have them do, or a different way of
Right.
going about it, I have them put the negative stuff, the fear, in the left hand,
Right.
which is, and I ask them which is their dominant side. If this left hand is non-dominant, I have them put the fear here and the positive bunches in this hand.
Right.
So in the future, if they feel any sense of fear, I have them squeeze the right hand,
You get a return of that anchor.
and it returns
Right.
the positive and quells the negative reaction.
Interesting.
So
Okay.
all they have to do is do that, and it brings back into their mind the success that they had, and they've lost their fear.
Exactly.
Yeah.
We're going to wrap up here. Next time,
Yeah.
we're going to do cure of allergies and
Okay.
hay fever.
All right.